Welcome to Rubin On Point, a podcast about cancer, resilience, and being human. I'm Dr. Dan Rubin, and together we'll uncover the true power of resilience, the strength to recover, adapt, and thrive through life's toughest challenges. Each episode will bring bold ideas, transformative practices, and inspiring stories that redefine what health, healing, and what the human spirit can achieve. And you're going to meet some really cool people along the way. If you're ready to turn obstacles into opportunities and live with greater purpose and courage, you're in the right place. Let's get started. Your journey to resilience begins now. Welcome to Rubin On Point, a podcast about cancer, about resilience, and most of all about being human. Of course, I'm Dr. Dan Rubin, and I'm here with somebody that I greatly admire, someone that I've learned from throughout the years. This is Dr. Carrie Bordinko.
Thank you, Dan.
And she has started Benessair several years ago. I remember when
2020, yes, right in the middle of COVID.
Yeah, oh, I do remember that. It's just a phenomenal place, and I've always admired the work that you've done. I still think that you are one of the smartest people that I know. I remember the work that you were doing before Benessair opened. We've worked together on patients.
We worked together, I think, almost 20 years now, going on 20 years.
I just think you're an amazing physician. You're an amazing visionary. And thank you for allowing us to come here and talk to you about your knowledge and about what you've done and tour your place. Thank you.
Well, thanks for having me. You know me, I love talking about wellness, getting people healthy, finding a new pathway for health.
You put Benessair together because you really believed in the intercommunication and the true integration of integration.
Yes. It's a word that's thrown around all the time and rarely practiced, which drives me crazy.
Would you say the central feature or just one of the main features of Benessair is the hyperbaric chambers? When we developed Benessair, it wasn't actually even on the roadmap, which was kind of crazy. It happened, and then it became a central feature. Mm-hmm. So yes, unintentionally, it is definitely our star child. I don't want to downplay anything else we do because it is really, like you just said, it's the integration of everything and finding the right piece that's broken on someone and supplying that for them. But hyperbaric, I've learned over the last 5 years, just has so much application in medicine that even our doctors and hospitals have no idea about. I was in residency at a wonderful tertiary hospital, very large, worked ICU, worked emergency room as part of my training, and we never knew. The word hyperbaric never even came across my entire time I was there. To get outside of that training structure where we took very sick, dying people daily and not know that that technology was available is, to me, a crime in medicine, and I know even in your space in naturopathic medicine, I doubt that you guys hear much about it until you go to a conference or you're in your post-training. Well,
you hear about it.
Certainly not taught in schools as far as I know. I mean, I haven't been in the school system for quite a while. But,
like both of us, Yeah,
exactly. But it's not normal. And one of the things, actually, the concept that I've learned from working with you about hyperbaric is, number one, you really need a doctor to okay somebody for hyperbaric.
Absolutely. Yes. No one should be getting in a chamber unless they have spoke with a medical professional who understands the technology, because hyperbaric, it's not just for entertainment purposes only. And I use that because so many times I feel like people are going into it thinking this is just a fun ride to go in. It is a real medical treatment.
Yeah, I take it very seriously when people ask me. And people do flippantly say, oh, what about hyperbaric? Or and especially people that I might do telemedicine with who are in a different state and like, hey, do you think hyperbaric would be good for in like a message in the portal? I'm like, hang on a second, right?
We need to look at this from all areas. So hyperbaric can offer a tremendous amount of benefit, but hyperbaric can be very harmful to the wrong person being put under pressure and oxygen tension. So you do need to speak with someone. They need to do a thorough medical history on you. And at that time, they can talk to you about the benefits, because one of the other things that we pride ourselves on is the integrity piece. So some people read about hyperbaric in social media. They've seen some video, movie, whatever on it, and they think, well, this is going to be great for me. if we get that person in front of us, we talk about what their goals are, what they're really trying to either remedy, cure, or just have higher quality of life. And we let them know this is a great technology, but it won't work for you.
Yeah.
So this isn't where you should spend your dollars or have your journey go. I think that's really important as well. You're not going to get that if you're going to a facility where you do not have the override by a physician, meeting with them, having that integrity piece, and counseling them appropriately from a medical training standpoint.
What are some of the problems that you see in the industry as a whole in hyperbaric? And what I mean by that is like a side of the road hyperbaric center.
I think that what I see as a problem is maybe being brought under kind of the limelight now because of the recent news media and the recent fatalities that have been happening. You know, we've gone decades without fatalities in hyperbaric, and now we have 2 in less than 6 months. And that is, I really think it's coming about because we do have these pop-up hyperbaric centers now, right? We have everybody from any level of training, from massage therapists to personal trainers, physical therapists, or just someone with absolutely no medical exposure, opening up hyperbaric centers without any oversight or medical directorship. So when that happens...
And that's legal.
Well, legal's a big term. There's definitely, so there's liability.
Well, it's not by prescription only. How about that?
It technically, real hyperbaric is by prescription only.
Yeah, but not in these pop-up centers.
If they're not in the pop-ups, they're not. So according to the FDA, if you are going to run real hyperbaric, which are, when I say real, what I mean is we have great studies for the last 50 years in many different countries that are reproducible that show the benefits of using hyperbaric. Those studies are built using real hyperbaric centers, real hyperbaric guidance. The pop-ups are not following the criteria for that, what we call real hyperbaric. So in the industry, we use a word called fake hyperbaric. Some people used to use the word soft shell versus hard shell, but what you don't understand are there are hard shell fake hyperbarics. So that shouldn't be really used that way. But you know, there is legal liability if you put somebody in and something goes wrong, even if you're in a fake hyperbaric, because you can still do harm. And that is...
What's a fake hyperbaric?
So a fake hyperbaric is a machine that does not deliver 2 criteria. For real hyperbarics, or to be considered medical grade hyperbarics is a term we like to use, you must deliver 100% oxygen at all times, and you must also exceed a pressure of 1.4 ATA. Now that pressure gradient is a measurement of depth. And so many of the fake hyperbaric chambers will deliver air pressure. So air not being oxygen, right? At a greater
air pressure,
depth.
not oxygen pressure.
Not oxygen pressure, right? So both criteria have to be met. Many people say, oh, well, we go to a pressure of 2.0 ATA, but under air. Air is not oxygen.
Is that dangerous?
It is less dangerous, but there's also no therapy delivered.
Right.
And that's the problem. So when we talk about
you could just go outside and breathe hard, right?
Yeah, pretty much. Yeah. When we talk about legality or liability, because I think the two go hand in hand. If you put somebody in that situation, but yet you have guided them thinking they were getting hyperbaric and they have a failure of something medically happen. So I think there's been some great landmark cases out there where people have had true injuries, either burns. I mean, we all know that Jeremy Rayner, we know that Jay Leno, both had some catastrophic injuries, life-threatening injuries. They both were very public that they went to a hospital and they received over 100 hyperbaric treatments to come back from those injuries. Many people don't know that Michael Jackson did that in the 80s. This is not new technology. That's what saved him when he had the Pepsi commercial fire, right? And allowed him to go back to singing and doing things. So if you're in a real chamber like they have in the hospitals, or like we have at Benessair, we mimic exactly what hospitals do, you're going to get predictable outcomes. If you're in a fake chamber and you think I went in for my burn and then you still end up having a limb amputated because the burn never healed, there's a liability there. And there's no physician oversight, which is also a big problem.
So do you, so one of the things I've learned is to make sure that there's doctor oversight, which is why the only place that I refer is here. It really is, because I know your machines, I know you, I know how.
And we are 100% on site. If that machine is open and running, there is a doctor here.
And that's a really big deal.
It is a really big deal. You know, we have done over 17,000 treatments in 5 years. We have had 2 codes in our chamber. It can happen. It can happen to healthy people, but a lot of people who are going in the chambers for medical reasons, obviously they're sick. You know, they have comorbids, right? I know we've shared a brain cancer patient together. That person has pressure that can cause them to seize at any moment. We know that's a known side effect. If they seize and then have airway problems in that chamber, you need to have a doctor there who understands emergencies, ACLS, who can call 911, who can stabilize that patient.
This is why I refer here. And, you know, the other thing too is people ask me all the time, like I was saying before, should I do hyperbaric? What do you think about hyperbaric? This, and I said, you know, I'm not the expert in hyperbaric. I simply am not. You can't be an expert.
You cannot. We agree.
I obviously, you know, see people who have cancer, and I'd like to understand some of the general health benefits. I think we should also talk about some of the potential anti-cancer aspects of it, or how it may intermingle with conventional treatments, but really get to know it from not only an oncology perspective, but from, because of the purpose of this podcast, a resilience perspective, and about being human. I mean, let's start there. For people that are looking to generally improve health, who don't have necessary comorbidities that would contraindicate them from using hyperbaric, who are, can people come into Benessair without being members here or without utilizing other of your services and just do hyperbaric oxygen?
Oh, absolutely. Okay. Everything that we offer at Benessair is open to the community. So there is no membership to come in the door. You come in the door, we're happy to give you a tour, let you see what the menu of services are, and then you self-refer, or you go back to your physician who knows you better than anyone else, and you say, hey, what out of this do you think would help me the most? We try and give you enough information and guidance that you can make those decisions yourself. To get into the hyperbaric chamber, of course, you do have to have that initial screening that we've been talking about with the physician. It's done by a physician. Usually myself, but sometimes someone else who's covering me. And once that screening is done, your direction as far as how much you use that technology, what you're using it for, I will give you a clinical opinion on that, but you're going to self-direct and guide yourself. So let's just talk about the weekend warrior, right? We have so many of them in our community. Arizona is a very healthy state. People come in and they say, look, I'm training as hard as ever, but I'm hitting my mid-50s, I'm hitting 60s, it's getting a little harder to recover the next day. I wish there was a secret. And I say, use hyperbarics, use the recovery that so many of our professional athletes use. So once a week, Saturday mornings, why don't you start your weekend by popping in the chamber for 90 minutes, rejuvenate the cells, heal the mitochondria, right? Get rid of all the inflammatory chemicals that we build up in our body, the lactic acid, everything else that happens from us pushing our bodies in a healthy way hard, clear all that out. It's a reset button for the week. You will perform better.
And so can they work out that Saturday or that Sunday?
They could. Absolutely.
Okay, so after the hyperbaric?
Pre or post?
Pre or post.
I do both.
Got it.
I do it based on when I can find time. So sometimes it's right after workout. Sometimes it's before my workout. That really is not as tangential.
How often do you do hyperbaric yourself?
I really try hard to get in once a week.
Okay. And then is there a certain prep that you have people at Benessair do, knowing that this is not going to be a prescription for somebody watching this podcast, but a certain, maybe a protein shake, or should they eat? Do people eat beforehand, or it doesn't matter?
You know, none of those things have ever moved the needle in hyperbaric. So one thing we don't want you to do is go in super hungry, because hyperbaric does drop your blood sugar by 20 points. And that we know for a fact. So if you're diabetic, we ask you, if you're wearing a CGM like I am, we ask you, what is your blood sugar before you go in? If you're already at 65 and you're going in, we're going to have a clinical safety problem when you're in there. So if someone's like, oh yeah, my blood sugar runs low, I forgot and I skipped breakfast, we have a wonderful protein nutrition bar. We'll get you fed before you go in. That's important only because of that is one of the actual, you could say, benefits or negatives of hyperbaric.
How does hyperbaric fit into just being a human? You talked about maybe the weekend warrior. Are there any other aspects because we're now living in certain metropolitan areas? Phoenix is one of those where there's certain levels of toxicity. There's a lot of building out here. We don't have the best, wind flow, and we tend to have smog.
Our ecosystem is altered. Yes.
So given this milieu, do you find that it could be valuable for people just for
a detox?
A detox.
A detox.
How does it detox?
Well, I think I want to use an example that's fairly well studied that we can relate to in hyperbarics. And that is, we know that there is something called black mold, that certain people are more susceptible than others based on your genetic makeup. And that's something I know you deal with probably more than I do. And we know that that mold likes to find fatty tissues and live in it. And then it has a really hard time getting excreted. Very similar to what you're talking about with our environmental toxins, plastics, whatever. They like to stay in us, right? They like to cause illness. When you administer oxygen, when you administer pressure at the same time, it fundamentally changes the dissociation curve for carbon dioxide, for nitrogens, and for oxygens in your bloodstream. That oxygen can literally permeate and push and create cellular change. You know, one thing I like to educate people, right? You know that about me. You've worked with me long enough. So even if someone is not a patient of mine, but they're using the center, you know, I'm always going to go out, I'm going to greet people and talk with them. I commonly get people walk up to me in the lobby and say, "Hey, Dr. B, got a quick question for you. Will you answer it?" And I'm like, well, if I look at my watch, okay, I've got 4 minutes. Sure. I will try and give general information. I will try and help. To me, the greatest gift we give as physicians is we empower people with good knowledge, right? That's what we should do.
Doctor as teacher is the original definition of doctor.
Absolutely. And so I really walk that walk, and I try and teach them. I can't teach you everything that's in my head, but if they say, how do I go back home? So many people come in and visit from outside cities because they're seeing a specialist like yourself. They fly in for you, and then they need to use our resources around it. And they're like, okay, I'm getting ready to go back to another city. I try and give them some pearls about how to understand the legitimacy of this treatment, because it is a wonderful healing dynamic that crosses so many different disease states that can be used, but you have to be in a real chamber to get the benefit of it. So we talk about things like, if there's, like you said, if there's no doctor on site, okay, you're not in a legit chamber, because no one in their right mind would own, operate, or run that center illegally. So it's not happening. You know, is that doctor a doctor? I mean, what are the credentials? Unfortunately, that horrible fire that killed the 5-year-old in Michigan was a person who had a PhD doctorate, but unfortunately introduced themselves as a physician. Every client who went in there heard Dr. So-and-so, right? Did not understand there was no medical doctor, no one with any medical training in that building. Had 2 events happen. So we teach people that. We teach people, when you're getting in the chamber, if you're allowed to take your cell phone or your iPad in with you, or wear your Apple Watch or a bio tracker, you're not in a real chamber, because that would blow up.
What about a glucose monitor?
Glucose monitors are approved. And think about how many people who are sick in the hospital are using hyperbarics to save an amputation or a burn. So many of those are diabetics. So one thing that's wonderful about the glucose monitoring companies is they've all safety tested their equipment. We have a list of equipment that has been safety tested: pacemakers, loop recorders, different implantable battery operated devices. We now implant so many devices in humans to do functions, from helping them swallow if they've lost the ability, to helping stimulate their brain if they have Parkinson's. So all of those devices are safety tested. We take the serial numbers, we talk with the manufacturer on every person, and then we let them know if we can go in or not. Safety is the only thing, the words that come out of our mouth all day long here. Yeah.
That's why we're setting the record straight on hyperbaric. I'm so happy to be here and to be able to talk about this, because I think through this podcast, maybe we'll save some lives.
Absolutely. I mean, that's the goal. We need to educate the consumer what they're watching for. Yeah.
Does one particular story about a wonderful healing journey for somebody come to mind?
Ooh, wow. You know, it's been wonderful. 17,000 treatments, and we have some amazing healing journeys. But there have been several ones that definitely, you know, I got goosebumps right now thinking about this. So several ones. But, you know, we have a young little boy. The youngest patient we've ever treated is 5 years old. And he's now 6.
Yeah.
5 is young.
Interesting.
And we don't do pediatrics here. So we got called, the family members of this wonderful young boy who's just so polite, called us and said, look, we really need to get him treatment. And he's had treatment in Dallas, Texas. We want to be able to continue his treatment home so he can be with his siblings. It was a holiday coming up. They wanted to be able to spend the holiday with the family. And they said all the hospitals won't take him, including Phoenix Children's. because they won't do hyperbarics for what's wrong with him, because it's off label. So in our industry, in the hospital, you must meet certain criteria by insurance companies to use the technology.
Okay.
And so the hospital said, reach out to Benessair. They might be able to help you. I spoke with the family and I said, yeah, 5's pretty young, but I'm happy to speak with the medical director down in Dallas, understand the protocol, what they're doing. And if we can safely administer it, we're willing to go through that journey. And this wonderful little boy came in post-operatively and needed this treatment to really heal, to participate with his family in the holidays, and to also be able to go back to school. And he was just so wonderful, so pleasant. We had a little routine that we did with him. He loves chocolate chip cookies. So every time, he was in every day. When he would come out of the chamber, we would have warm chocolate chip cookies waiting for him for being such a good kid in the chamber and following the rules. And for us, because you've heard me talk about it multiple times, that safety is so important. Having a 5-year-old in and making sure that he can actually obey the rules to keep everybody in the room safe was really important to us. And he did a phenomenal job. We've had him back 3 different times recovering from his surgeries. But, that's true joy to the whole staff to be able to deliver that care.
I mean, you bring a child into any facility, even ours, and it's like, okay, in our facility, in the oncology setting, in the IV room, there's a bunch of grandparents in there. They're like, okay, I don't have it so bad.
Yeah.
You see a 5-year-old coming in. That is wonderful. I do have to ask, in terms of resilience, because I do want to talk about, where do you see human resilience and hyperbaric coming together? Or do you?
Well, I think they're a partnership. Okay. Absolutely, right? So I think that as we can make legitimate hyperbaric settings more available to people, because I think right now it's a commodity we don't have a lot in our communities. There are so many communities where people don't have the access to employ that technology. We've touched base on this before. If you get the fundamentals right, and we all talk about nutrition, sleep, hydration, understanding who grows your food, where your food comes from, right? Lack of preserves. If you can nail those things and then you can layer hyperbaric on top, your resilience threshold is going to increase. I mean, you're going to be able to do more things and defy we call chronological age aging. And I struggle with these words now, because you and I have seen so much transpire, where a friend of mine just wrote a book, 90 is the New 60, that came out about 3 months ago. I'm hoping to get him on a podcast. He's wonderful. And, it's not just a catchy phrase, it's reality. I have 90-year-olds in this facility pushing the sled down the middle of the gym who
I hope to be one
back in 2013 were recovering from heart bypass surgery with 24-hour nursing care in a wheelchair.
Wow.
So that's not age. That's resilience.
That's resilience.
Right?
Resilience, I think, is really the new word. And it's something that I think people are starting to pay a lot more attention to. We do have to talk about and cover oncology and cancer and the world of hyperbaric. I remember back in the early 2000s, and I was doing some work at a hospital in the Southern Valley, and they had a hyperbaric chamber. And at that point, it was thought that hyperbaric oxygen for somebody with an active malignancy would create and that it would cause more angiogenesis. We didn't know as much about blood vessel growth, malignant based blood vessel growth at the time. And I know that the script on that has flipped. We know and understand a lot more about the way tumors, develop their blood vessels and the science behind that and the anatomy behind that. Do you have people with active disease coming into your center?
We do. And, I want to just say kudos to our community physicians, our radiation oncologists, mostly some of our medical oncologists are starting to get training in their programs in hyperbaric. And I think that's phenomenal. Yeah. So the local trained oncology crew, not so much, but some of the big centers around the U.S. are incorporating hyperbaric as part of their recovery from radiation damage. And that, we care so much about quality of life. Yeah. We want to obviously give them the best success story that we can to beat the cancer, or palliate the cancer if it's about quality of life. But we have not always felt positive about adding hyperbaric in. And that is completely changing. Yeah. We get common referrals now, active cancer treatment. The radiation oncologist will literally call us and say, I'm going to start I'm going to start radiation treatments. He's going to go through a cycle of 36 over the next 7 weeks, starting next week. I really need him in the chamber at the same time. I need to diminish that possible toxicity.
You mean right after or right before a treatment during?
Literally.
Yeah.
Literally.
Well,
treatment can be at 1 and they're in my chamber at 3:30.
We know that for radiation to be effective and to exert its cancer cell killing ability, oxygen has to be present on site where the radiation beam hits. Have you given any thought to pre-treating somebody with hyperbaric and them going immediately within 45 or so minutes to get radiation?
We know that there's some science being studied in that area right now. And I think the problem, once again, like we talked about, is the availability of chambers. There really aren't that many in the U.S. and being able to align with that. But there have been some wonderful conversations with our community radiation oncologists to talk about trying to line up and do that. Yes.
I would love to be part of those conversations. And I think we know where to start.
We do. Yes.
That being said, too, also there's problems with delivery of whether it be a chemotherapeutic, whether it be a nutraceutical, whether it be a supplement that they're taking, whether it be a biologic agent that they're taking daily by mouth or an oral chemotherapy. But there's a problem with delivery of that medicament, that anti-tumor medicament, into the tumor because tumors have poor blood vessels. They have good lymphatic flow too, but they have poor efferent lymphatic flow. So tumors start to get, they have internal high pressures. And when you deliver something via the blood, which is usually at a lower pressure than the internal pressure of a tumor, you can't get stuff from a low to a high pressure. I see hyperbaric helping to improve those blood vessel highways to lower that pressure inside the tumor and actually being something that can help the delivery of those medicaments from an anti-tumor perspective.
I think we can absolutely look at that, but then also let's remember that the oxygen delivery using hyperbarics, because of how pressure and oxygen combine together for a synergistic effect, kind of greater sum than the two independent parts, is you actually don't need a blood vessel to get 100% oxygen to a tissue. And that can actually completely change that dynamic in the tumor as well.
Right. And so by doing that, we're going to lower the hypoxia-inducible factor alpha.
Correct.
So there's going to be less angiogenic signals. So the blood vessels are going to become more sane. The architecture is going to be more
And you're
perfect.
going to be able to deliver what you need to.
Yes, I see it as valuable. Do you know of any direct anti-tumor aspects, cancer-killing ability of hyperbaric oxygen?
I don't.
Yeah, I don't know.
No one. Okay, because if you know something, I'll say no, and you come in.
Okay. And I was going to say, no, I am not aware of that. Okay. I don't know that it is truly an active anti-cancer agent, but I think it plays a role.
I think it's really the hypoxic effect role that has its greatest edge.
I mean, our friend Gary Brecka says that, disease is generally a lack of oxygen in different parts of the body.
Right. And hyperbaric is nothing but a delivery of oxygen. Yeah.
Wonderfully said. Well, thank you for joining us on Rubin On Point. Until next time, we really hope you enjoyed this podcast, and I really had a great time talking to you, Dr. Bordinko.
Thank you.
Thank you for joining us on Rubin On Point, a podcast about cancer, resilience, and most of all, about being human. I hope today's conversation inspired you to see new possibilities for growth, healing, and strength in your life. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with someone who could use a little extra resilience in their day. Remember, no matter what challenges you're facing, resilience isn't just about bouncing back. It's about building a life of purpose, connection, and vitality. Until next time, stay strong, stay healthy, and take care of yourself and those around you.